Well, good evening again, everybody, and thank you for joining us tonight. I am Laura Bertnazzi, and I am the Dean of Undergraduate Enrollment here at Regis College. And tonight we are here as part of our Operation MoneyWise grant opportunity to explore opportunities to support our military-connected learners and their family members in their pursuit of higher education, and to learn more about the VA benefits available to them. I am joined this evening by Nancy Blanchard, and I'm going to turn it over to her to talk about the wonderful resources available from her team. Nancy?
Okay, thank you, Laura. Good evening, everyone. Thank you so much for joining tonight. I know it's a rainy night, but you still was able to come out and join us. Thank you, Regis College, for sponsoring this and having this, and I really appreciate being here to participate and help out in any way that I can. My name is Nancy Blanchard. I am the Deputy Director for the West Suburban Veteran Services District, and I will get into more of my role and the benefits and services that our office provides. Okay, so we work independently in accordance with the state law and regulations to administer benefits from the Massachusetts Department of Veterans Services, which we call DVS, and the Veterans Administration, which is the VA, to eligible veterans and their dependents. So from now on, if you hear me say veterans, unless I say otherwise, it includes dependents and their family members as well. So just to let you know that veterans, depending on what service you are trying to enroll or apply for, they are different definitions of what a veteran is considered. And we'll, get into that once we see the upcoming slides, and depending on the benefits and services that we provide, you'll see that as well. So what we do. So like I said earlier, we provide benefit programs to eligible veterans and their families who are in need. So some of the benefits, like if I were to name every single benefit program that we provide, we could be here all night and pretty much the rest of the semester. So the most or the major ones that we help out in the veterans within our district is the home loan programs, helping out with the disability, VA compensation, pensions, educational programs, any healthcare. What we do is we're like a bridge. If you can just imagine that and just picture that we are a bridge to these resources. We might not be able to provide them ourselves, but we're able to bridge that gap into where you can get these services and benefits. So our office is like the main office where we can provide you and point you out to the resources and agencies that can give you these benefits and services. Okay, so we can help out with storing your discharge paperwork, information, and service records for the veterans that we serve. So when we say store discharge, we have DD 214s. If you guys should know what that is. That's your separation record, or your discharge, meaning honorable, dishonorable. It just states whatever you service, your type of service that you provided, and it just gives an accurate record of your military service. So if you do not have the golden ticket, as we call it, because that is everything that you need in order for you to gain these services and benefits that you need to obtain, more than likely, or most unlikely, or 95% of the time, you will need your DD 214 or your discharge paperwork, and we can assist you with that as well. So we partner and collaborate with the Department of Veteran Affairs, or the VA, and agencies on multiple VA matters. So when we say the VA, you just need to realize that VA have two entities. There's your healthcare side and there's the benefits side. So of course the healthcare take care of any health issues or anything that you may need healthcare wise. And then you have the VBA, which is the benefits side, which is your education benefits, your home loan warranty or guarantee, anything that has to do with other than your healthcare services is what you will get from the VBA side. So just remember that when we talk about VA, that does include the healthcare and the benefit side as well. So we assist surviving spouses and dependents in obtaining survivors' benefits as well. So even when the veteran deceased or the military service member passes away, we do provide services and benefits to the surviving dependents, surviving spouses as well. Just for instance, surviving spouse, if the dependent was receiving a disability compensation, we can roll over depending if the eligibility, depending on the criteria, we can roll those benefits over to the surviving spouses and dependents as well. So our office, who we serve the veterans and the families in Needham, Wayland, Wellesley, Weston, and Westwood. In Massachusetts, we have like 351 cities and towns. And within those 351 cities and towns, a VSO, which is a veteran service officer or a veterans agent, as myself, we have one. If it's not in each town, there's a district. So each city and town is covered by a veteran service officer or a veterans agent that can help you with benefits and services. Again, this is to include the dependents and their families as well. And if you're not in my district, you can go to the link that's here at Mass Vet Advisor. You just put in your zip code and it will actually pull up who the actual person is and the town or the district that all the town and the districts that they serve, their office hours, and if they have a website, it'll pull up their website. And if you can't find your VSO for some reason, you can also go to the DVS website, which is the mass.gov under veteran services as well. So now to the nuts and bolts of the presentation that we're providing. So the services that we provided, like I stated earlier, we do so much for the veterans and their families. Most people, when they hear about the veteran services that are aware of the program, just think that we do the Chapter 115, which we'll go over later. And we do so much more than the Chapter 1 financial assistance. We provide educational assistance. Now, we do not do education programs or benefits, but we guide veterans to help them where to get the assistance, because the education piece there's so much under the education umbrella that is just not overwhelming, but there's just so much that is to be covered that they have their own entity under the VBA umbrella. So most of you all know about the 9/11 Chapter 33 bill, which if you are a veteran that served 90 days, and it doesn't have to be continuous, if you serve 90 days after September 11, you are entitled or eligible to receive the 9/11 GI Bill. Now, some veterans come up to me, well, I did 90 days and they weren't consecutive. but I wasn't entitled to the 9/11 GI Bill. And then I asked them, well, what was the character of service that you received? Because your character of service has to read honorable on your DD 214. So that is something that other people have to realize and see that the other educational programs that are out there, there are, stipulations and criteria as far as character of service. There's other VA education and training as well, other than the 9/11. I don't know if most of you came in before 9/11, but there is the Montgomery GI Bill as well. There is VEEP, which is the Vietnam era. There's so many other VA training education programs that are out there. Now they have the vet readiness training. If you're not aware of that, that covers those that are at least 10%, receive a 10% rating disability and they cannot work. They can also go to school, finish up their school the same way they would as if they had a 9/11 GI Bill. Once again, you have to be service connected with at least 10% in order for you to receive the uh, Chapter 31, which is the vet readiness. It used to be called the VOC rehab, but they just recently changed it to the vet readiness training. There's entrepreneurship training that there's apprenticeship training, there's even flight training. All that can be found under the VA Gov /education. Uh, Again, there's just so many opportunities. If you don't fall under the 9/11 umbrella, there's other categories of educations and services and training that you can fall under. So the yellow ribbon program, the yellow ribbon program, most schools have it. I know Regis has it. And if you qualify for this program, just remember that you have to, what it does is enhances the 9/11, 911 GI Bill. So one has to qualify, one has to have the 9/11 GI Bill, and whatever is not covered with the 9/11 GI Bill under that tuition, then the yellow ribbon can cover the rest, depending if that school is listed in the yellow ribbon program. So the program is not only 9/11, but the institution that you apply for will have to be listed in the yellow ribbon program. And you can also find that in the va.gov education under yellow ribbon programs and list of schools. So it's a good thing that Regis covers that, because if the 9/11 GI Bill doesn't cover it all, the yellow ribbon program will cover the rest for you. So the Forever GI Bill, which is an act of I can't pronounce Cormley, it was passed in 2017, which extends the GI Bill, the 9/11 GI Bill, to 48 months. It used to be like 36 months to 48 months. It also extends it to 15 years. Before it was 12 years. There's so many different laws and regulations that has changed under the Forever GI Bill. And so if you're covered under the 9/11 GI Bill, you can go to the website that's shown so you can see the different extensions and the different waivers that they now cover under that act that was changed in 2017. Okay, so for the COVID-19 updates, this is pretty complex, so I'm gonna try to do the best that I can to cover the COVID-19 updates. Now, within the last year, some all of the institutions either closed or they transferred to online through online courses. Now, if this was impacted and you were impacted by this, resident courses that you were taking before is now online courses, your housing rate will still remain at the resident course rate until December 2021. So if you were impacted by the online course being transferred from the resident course, you can still even if they are resident courses now, you can still have that option to take online courses up until 2021 and still get the same rate of the resident courses. That's if you were taking the courses before, the pandemic started. Now, if the new courses that you take now, you're a new student, this is brand new to you, and the courses that you're taking now, there are no resident courses, they're just online only, and that's the only thing that they offer. You, again, will be entitled to getting the current resident course housing rate as well. Also with the 9/11 GI Bill, just remember you get up to $1,000 stipend for books, and then you get lab fees waived, and there are certain fees that get waived as well under this bill. Now, for the Massachusetts guards that serve in the state, they have a tuition waiver bill that they have, and they can attend the National Guards. They can attend the school with the tuition waived. Now, when they say tuition waive, it's just tuition waive. That doesn't include the books and the fees and the lab fees. Also, the state of Massachusetts for veterans, if you attend a state school, a community college that is a Massachusetts state school, your tuition can be waived, granted there is availability. Again, that's just tuition that will be waived, not the books or the fees like lab fees or whatever other fees that they may be associated with the tuition, just the tuition itself. And that's for veterans under Massachusetts though. So remember earlier when I said there's different definitions for veterans, the state of Massachusetts has a different definition of veteran under MGL chapter 43, which is you would have to serve 90 days during a wartime period, one of those days having to serve actually in theater. Okay, so for education, again, there's like I said, there's so much information out there. So the Yellow Ribbon, Chapter 33, Forever GI Bill, and the updates are pretty much the top subjects or the top topics under educational right now. Okay, so next we'll go on to financial. So I know that most of our students are either out of town, or even if you're Massachusetts residents, the Chapter 115 can provide financial assistance, whether it be emergency assistance, medical assistance, rental assistance, but the Chapter 115 are for Massachusetts residents. So most students that are out of residence, out of town or not in Massachusetts, but now that they have changed some of the laws under the BRAVE Act, now they say, like, if you're in between semesters, there is you can get Chapter 115 financial assistance. There's like the application that you would fill with the town that you're residing in, which is if you're with Regis College and you're on campus, you would file with us. And for the Chapter 115, there's a formula that you have to still adhere to as if you were a regular resident or regular veteran resident applying for the Chapter 115 program. Next, we have the work study with the VA. So for the work study, you have to be at least a 3/4 time student in order for you to work with the VA. There is an application process and an application that you need to submit, and that is something that our office can help as well. Now there is a law that they are passing now. I can't remember if it's passed already, but they were talking about that the work study that's with the VA, they are now trying to include congressional offices as well. So if you're interested in doing work study, it's not only the VA that you can do your work with, you can also start working in congressional offices as well. And then next we have the public assistance. Public assistance is just falls under the Massachusetts umbrella of, the SNAP benefits or the transitional assistance or just any that regular residents would be entitled to, a veteran would be entitled to as well. Of course, there's different stipulations as far as income and assets, but the agencies, we would help and connect you with the agencies that you would need in order for you to do the public assistance. So as far as financial, also the VA, if you owe the VA any money or like the GI Bill, there's any money or for education or anything, the VA right now is currently waiving or pausing all debt right now until I believe it's until, there's so many dates to remember. I believe it's until December as well, December 2021. I can find out for sure what it is, but they have extended the debt management under the VA. So if you owe the VA any money, they will not collect from you now. They have extended the deadline for you to owe them or to give back that money. Okay, so healthcare. So healthcare is another one. Eligibility. So veterans, again, if you fall under the 90 days or you have an honorable discharge, you can enroll into the VA healthcare system. The VA healthcare system, they do have an income requirement as well. And depending on what the income requirement, is, if like, for instance, you're just trying to get the COVID-19 vaccine and you just want to be eligible for the VA healthcare just to get the COVID-19 vaccine, then they'll put you in a different category or criteria just so you can be eligible to get the vaccine, which, by the way, all veterans, spouses, dependents, and caregivers are eligible to receive the COVID-19 vaccine at a VA center. And that's if you're enrolled or not. So all veterans. So if you're a veteran and you haven't received your vaccine, doesn't matter about the age, as long as you're a veteran, your spouse and caregiver or those that are in CHMPA, you can receive the vaccine. So in as far as if you're under the VA healthcare, it does qualify as healthcare coverage. On your tax, it says, do you have healthcare? If you fall under the VA and that's the only insurance or that's the only thing that you're covered by, that is covered by the healthcare coverage. So for mental health care, which is very important, why I put that on there is because a lot of veterans now are wanting to receive care, but they don't know how to get the access to. So VA can, there's so many programs, especially with the Boston campus, which the West Roxbury falls under. The Boston campus has so many mental health care programs, including women's health, which is something which is a separate, falls under separate. They have OIF, OEF, they have PTSD clinics, they have LGBTQT, they have anything that falls under the mental health, either in TBI, you can qualify to get those services at the VA. Also, if you do not want to go to the VA for some reason, whatever reason that you might have, they do have the Red Sox Foundation, the home-based program with MGH, but you would have to go through the VA counseling number in order to get through the Red Sox Foundation MGH. But I think they were changing that to, you can just reach out to the Wounded Warrior Project in order for you to qualify for that, because not all states have that. And for us, fortunately for us, Massachusetts, we do have that. So the nearest VA from Regis, for the Regis students or those resident veterans in Weston, is the Boston VA West Roxbury division. And any specialty or any care that you may need that West Roxbury doesn't have, then you would be sent to the Boston campus, because the West Roxbury division falls under the VA Boston campus. The VA Boston campus is a research facility as well. And so, most of the MGH, Harvard Medical School, you'll find most of their docs, the doctors that are training or either are providing their research there. The West Roxbury division is a 24/7 care. Boston itself, the Boston campus that's in Jamaica Plain, is not. So the West Roxbury does provide 24/7 care. Now, if you happen to have an emergency and say you're not covered under the VA healthcare, and you're just a veteran and you just need help, need help, and the first thing you should just please call 911. Don't worry about, I have to go to the VA or how's this going to be covered. Call 911. The ambulance will take you to the nearest local hospital. Once you get to the local hospital, make sure you mention to the staff that you are a veteran. And then from there, the local hospital will take you to the nearest VA hospital. And once you're at the VA hospital, just remember, once you're discharged or upon discharge, you have 72 hours to report to the VA that you were sent to the ER at the local hospital, so they can cover your cost and cover the ambulance transportation as well. Of course, you can get this information under the va.gov community care, or you can just reach out to me as well. Okay, so we're near the end. And first of all, thank you again for your service. And at this time, if there are any questions, please let me know and we will take your questions.
Thank you so much, Nancy. One of the questions I do have is, your office supports our veterans in this regional area. If you're not from Massachusetts, what's the best way to look up the local resource for them?
Sure. So let's see. So was this website here, the massvetadvisor.org. If you go there, and then once you're on that website, on the lower left-hand corner, it'll ask you to put your zip code. Once you put the zip code in, it'll bring up the person's name, where their office is located, and their website as well.
Fantastic. And if they are not from Massachusetts, is there a directory, or are there certain search terms that would be beneficial to utilize in that situation?
So if they're not from Massachusetts and they need services, I didn't put it up here, but they can call the Massachusetts, the DVS, the Department of Veterans Services, and that's mass.gov under veterans. And then you'll see their website, and then there's a main number. Sorry, I don't have that number on there, but there's a main number that you can call, and then you can assist them. They can assist you as well. But if you're not from Massachusetts, but you're residing somewhere in Massachusetts, like you're living somewhere in Massachusetts, whatever town that you are, you can also reach out to them too, and they can help you out with that.
Thank you so much.
Just to add on that, Nancy, I just saw that the VA came out with a new toll-free number for veterans to get any kind of assistance, the 1-800-MY-VA-411.
Oh, okay. So that's something new for me.
It just came out in the last day or two from what I got.
Okay, well, that's good. Well, thank you. Yeah. So that's good that they have these accessible different ways for veterans to get a hold of people, because sometimes if you just have like the veterans, like the VBA information at 1-800 number that's posted here, like if you can't, get through there, and then you can get through that, 411, or just the one that you had mentioned to get on there. So the more the merrier. That's awesome. Thank you for that.
And I had one more question, if I could, Nancy.
Sure.
About the
Absolutely.
chapter 115.
Yes.
Because we're getting, especially during these times, getting more questions about that.
Mhm.
I know obviously the student has to be, vet in good standing and Mass resident. Do we have a sense of the limits of how much people can obtain through that?
So there's a formula. So we're not sure like what the limits, because it depends on the formula, what the rent, like what they're paying for rent, or what their mortgage is. So there's really, I know you can't, they're not going to give you like $3,000 or anything, but I know like one veteran was receiving almost 2,100. So it just depends on what income is coming in through the household, and what the rent is, depending on that, and then how much they, in that town, what their formula is for how much they plan on putting in for that.
Wonderful. Thank you for that.
Mhm.
Thank
Don't be
you,
shy.
Nancy.
You can ask
I know.
any questions. Mhm.
Awesome.
Hi, I have two questions. So I'm at Massachusetts College of Pharmacy and Health Science, and I'm in the process of my first year. But one of the things I've been trying to get information on is how to possibly get like internships at like VA hospitals or in a federal workplace, because that's access to a whole different sort of benefits with hiring within the federal healthcare system. And I was wondering if you had any insight on this.
So not as far as inside, as far as like a contact person, no, but as far as that work study program that I had mentioned earlier, that is a great gateway to get into like the VA, and we'll be able to help with internships. If you go onto the Education VA website, they actually do have some internship programs available if you're attending schools as well.
Okay, thank you. I also have one more question. Because of the whole COVID-19 crisis, the Congress in the last year created a reserve component to the United States Public Health Service Commission Corps. I was wondering if they and NOAA counted as a veteran component under the VA benefits, or if the, even though they're part of the uniformed services, because they're not military, they don't qualify.
So I know they're under the not the Forever GI Bill, under the COVID update, the COVID-19 update, they did include the reserve, certain reserve bills, because they do have certain bills that, that did include, they took that into consideration. So there are certain bills, I can't like name off all of them, but I do remember seeing like the reserve component, depending on like how many days or where you served or what you did. It is some of them, some of the reserve components are covered as well. And that, I believe it's the Forever GI Bill has a reserve component, and also the if you go to like, again, the education website, under the COVID-19 update, they have that as well.
Okay, thank you.
Good question. Nobody else?
Are there any other questions this evening?
Good questions.
Great questions.
Mm-hmm.
Well, if there are no additional questions, Nancy, thank you for providing your contact information. You're such a valuable resource. I know at Regis College, we've been grateful for our partnership, and we're grateful that you joined us this evening for our first of 3 Operation MoneyWise events, and we look forward to continuing to work with you. To our guests who joined us tonight, thank you so much. Thank you for coming. Thank you for your questions. We hope that everybody continues to be well, and as you're wrapping up your semesters, good luck on finals, and as you prepare for the summer, we hope that it brings you much deserved relaxation in the months ahead. But again, Nancy, thank you so much for your time tonight, and thank you for everything that you provided.
Thank you for having me. Of course, my number is up there, and I'm serious. I'm one of the ones, like, if you call me, have any questions, even want to just say hi, just please reach out. There's no silly questions. I mean, there's probably some resources that you could think of, or, you might have forgot to ask. Please feel free to reach out. If you have anything with the process of the VA or the benefits, the 1-800 numbers there, as well as the 411 number, as Bill has pointed. And please, if you have any kind of crisis going on, anything bothering, anything troubling you, please, that crisis number is up there for you. I mean, they make it so easier where you can even go online, you can text to that number. That number is there, is available, it's confidential, nobody knows. Feel free to just reach out. Anything all you guys need, please, don't hesitate to reach out. I'm very honored to be here. Thank you, and good luck to all of you.
Thank you.
Thank you so